Okay, so hello, this is Radionomics, and today we shall be looking into inflammatory and infectious diseases of the breast, part one. So, just for some background information, we have two types of modalities that we use for breast evaluation. Number one is an ultrasound. Now, this is mostly used in women less than the age of 30. On the other hand, mammograms are used in women above the age of 40. Now, this has to do with breast tissue density. Ultrasound is more suitable for dense breast tissue, which is the case in younger women, and the opposite applies to older women. Number one we shall be discussing is breast abscess. Now, this is usually a complication of mastitis. So you have all of the inflammatory signs and symptoms like erythema, swelling, pain, fluctuance, and fever. To be noted, it is usually a clinical diagnosis, but if it comes down to an imaging evaluation, you usually would choose ultrasound and it would give you echogenic vascular rim, so it's like a bright outline, as I'll show you later. And then you have those hypoechoic cavity inside with multiloculations. And just to be noted, if you do a Doppler exam, you would not see any flow, thereby indicating that there is zero vascularity in a breast abscess. So as discussed previously, this is a classic breast abscess. So you can see there is a hypoechoic center, and then there is a bright rim, which you would call a hyperechoic vascular rim outside. Also to be noted is there are these hyperechoic dots or loculations inside. And the Doppler is not shown, but if you try to do a Doppler, you would not see any flow. Okay, so number two is Mondor disease. Now, this is a rare inflammatory condition. Now, a patient usually presents with a tender cord-like mass in the breast with overlying erythema. The pathogenesis for this condition is that it is basically a thrombophlebitis of the superficial veins. Most commonly involved is the thoracoepigastric. Ultrasound is again the modality of choice. What you will see in this case is tubular anechoic mass with echogenic content, which usually is blood clots. There would not be any flow again on Doppler. And just like with any other inflammatory condition, you would see overlying skin thickness increase, as to be noted later in the image that I will just show you. Now, this is a classic example of Mondor disease. As mentioned before, you would see an anechoic mass, so no echoes, really black, and then you have these echogenic masses inside which indicate blood clots. The overlying skin, as mentioned before, is thickened due to the inflammation. So as you can see over here, the thickness is relatively more than any other areas you would see on ultrasound. Okay, so thirdly, we have granulomatous mastitis. Now, this is again a rare idiopathic inflammatory condition, usually seen after childbirth. Now, what you would see in this case is that it can be a bit of a challenge to differentiate it from a neoplasia, so it usually comes down to biopsying the mass. Nevertheless, on ultrasound, you would usually see a thick-walled hypoechoic mass with echogenic debris. As opposed to the previous two, this one would have positive vascular flow on Doppler. If you go down for mammogram, you would see increased retroareolar density. Again, this is just one of the presentations. There are a wide array of different presentations you can see on mammogram, and it can have really non-specific heterogeneous appearance too. Okay, so as mentioned before, you have a thick-walled mass, which is hypoechoic as opposed to the surrounding, with echogenic debris inside. And if a Doppler is done, you can actually note vascular flow. So if you go to a mammogram, as you can see, this is the areola, and this is a retroareolar virid heterogeneous mass. And what can specifically be noted in this case is that this mass is trying to retract on the nipple and the areolar region. Um, Basically, this is how it usually presents, but this is just one of the many wide arrays of presentations for this mass. And that is why biopsy is usually the choice to determine if this is not a malignancy.